my name is Mandy Daly, and today we're going to be talking about parenting after a preterm birth. When one has a preterm baby, all of one's expectations are flipped on their head. We expect to have our baby at our cot side, but in reality, we are separated from our baby at birth. Our baby is in an incubator. We can't touch our baby. We find ourselves in an environment that we are not familiar with. What are the infant's expectations at birth? An infant expects to stay in their mum's womb for 9 months. They expect immediate access to mum's body so they can breastfeed, and they expect to be supported by a family surrounding network. Unfortunately, they do have their expectations shattered. They find themselves in an incubator, surrounded by loud machines. They're separated from their parent. They may be exposed to lots of painful touch, and there are lots and lots of hands touching them that they're not familiar with. The parent in the NICU is often ill-prepared. They don't necessarily know their baby's coming early. They've suffered a trauma. All their dreams have been shattered. Their future expectations are on hold. Their parenting role is altered. They are not familiar with how to parent in a NICU environment. They're often full of guilt, fear, hopelessness, despair, detachment, isolation, disappointment. And time in the NICU is an emotionally and physically challenging journey. There can often be inconsistencies in care and issues over language and communication. And above all, it's a very highly technical and medical environment. The European Standards of Care for Newborn Health have 2 standards which can help parents parent within the NICU environment. These are infant and family-centred developmentally supportive care and follow-up and continuing care. And these are based on infant behavioural communication and cues. It allows the baby have their voice heard, and it's really good for baby's brain growth. These standards actually guide healthcare professionals and families how to better care for infants in the neonatal environment and to improve their outcomes. They ensure that families are actively engaged, that they have adequate supports in place, and that the NICU is adapted to suit the baby and the environment and the family. Parents should have continued access to their child for the entire duration of their time in the NICU. There should be no rules and entry times. Parents are equal partners in the journey. Parents should be viewed as primary caregivers and receive individualised support. They need to be taught how to observe, interpret and respond to their children's behaviours and cues. They should participate in the care such as nappy change, mouth care, temperature taking, expressing milk, breastfeeding and tube feeding their babies. They need education on pain and stress management in the neonatal environment. And they also need to be upskilled in how to provide some positive sensory inputs because the neonatal environment is full of negative experiences for children. And by looking at the auditory, the visual, the touch, the olfactory, sensory inputs, parents can actually improve that for their children. Parents can be taught how to comfort hold, contain hold their babies. They should participate fully in ward rounds. They should be shared decision making. And above all, they should also be supported throughout this journey. Preterm birth flips the paradigm of parenthood on its axis, and this is not what parents had planned for their journey. Families should also receive care in the environment where their socioeconomic, mental health and spiritual needs are being supported. And what does this look like? It looks like providing adequate facilities, psychosocial support, spiritual support, peer-to-peer support and couplet care. Preterm infants experience more than 700 painful procedures during hospitalizations, and 56% of contact in the NICU can be classified as highly or moderately intrusive, with only 8% of contact considered comforting. We need to protect the sensory development of the neonate because they have a low tactile threshold. Their physiological system is unstable and they potentially are rendered more vulnerable to the effects of repeated procedures. How do we manage pain within our NICU environment? We can encourage breastfeeding, we can support skin-to-skin care, we can offer the child sweet solutions, we can do non-nutritive sucking, and also help the parents with containment strategies. But above all, the important thing is that parents are part of this process. Bonding is where parents feel a sense of connection to their baby. It's a task-orientated adventure. Parents initiate the interaction. They focus on the baby's needs and they include more than one person. Whereas attachment is actually the baby's emotional connection to their caregiver. It's a baby responding to their nonverbal cues. The baby initiates interactions and it focuses on the emotional interchange. And bonding and attachment are really important for building resilience in later years and they can often be difficult in the neonatal environment, but not impossible. So how do we promote bonding and attachment in the neonatal environment? Well, above all, we need parents to be present for it to happen. We need to teach parents how to observe, interpret, and respond to their infant's cues. We need them to know what their baby looks like when their baby is regulated. So that will help them understand when the baby is experiencing stress and they can respond to it. And how do we do that? We help parents look at their baby's infant behavioral states. We have them look at their baby's physiological signs, their skin color, their muscle tone, the quality of their movements, being able to interpret whether the baby is in an awake state, in a drowsy state, when they're ready to interact, and above all, how to interpret when their baby is experiencing stress. Sleep is a complex and dynamic process of growth and restoration and is really important for brain growth. It is very important that your infant's baby sleep is protected in the neonatal environment, and NICU should have quiet time, and they should also have adaptations so that they can support infants' growth. Poorly managed environments can cause stress and discomfort, and it will affect growth. And sounds over 45 decibels negatively impact an infant's sleep. And sleep deprivation can impact cognitive, psychomotor, and behavioral development of the infant. We also have to balance the acoustic environment. If infants aren't exposed to maternal or paternal noise, it also actually negatively impacts their language development. It's important that we focus on the positive stimuli in the NICU environment. We need to increase exposure to those positive and meaningful stimuli for our babies by encouraging skin-to-skin care, early vocal contact, maternal paternal scent, access to breast milk so they can taste and smell it, positive touch, massage, eye contact with parents. What are the benefits of infant and family-centered developmentally supportive care? It improves bonding, increases breastfeeding rates, improves weight gain. It reduces rates of infection. It increases parental involvement, which is really important because the parents will be then bring the baby home. It has an impact on neurobehavioral stability and outcomes. It improves emotional well-being and cognitive development. Parents who are babies are cared for in an environment where family-centered care is adopted have a better recognition and response to their infant's cues. They report being more confident and competent at discharge. Babies' pain management is improved and their sleep is improved. Often leaving the NICU is a scary challenge for families because you're leaving the support network that you're used to. And the problems in the community is we often have lack of standardized practices in terms of discharge. There's sporadic follow-up of preterm infants based often on geographical locations. Infants sometimes are discharged from tertiary units to local hospitals, and there's a fracture in their care pathway. Parents aren't even often educated about what to expect for their preterm infant as they developed, and we have very sporadic community-based supports. What does need to happen before discharge happens is that a case manager is assigned to every child in the NICU. All parents receive timely and upskilling and education about discharge and follow-up. We do need this to make a smooth transition to home. Parents tell us that being discharged home is one of the most stressful things that happens to them, and they feel as if they are isolated, they have nobody to turn to, and it's very difficult when you don't have that support network. And if something happens to your baby at home, how do you recognise there's something going wrong? We do need to make sure that we integrate all services, that post-discharge it's a smooth transition to community-based services, and that families are contacted by community-based services the minute they reach homes. If there are any support services available for your families, please ensure that you introduce them to them while your family are in the NICU so that they have that ongoing, consistent support in the community. So everything that happens in the neonatal unit has an effect, whether it's negative, positive, or cumulative. And these effects can influence babies and their families for the rest of their lives. And parents are the best buffer against the neonatal setting and can contribute to improved developmental outcomes.